Welcome to Goal Getter, the AAP Physiotherapy podcast. My name is Jen Pantelak, and I'm the CEO of the Alberta Association of Physiotherapy. This show explores the power of physiotherapy, helping individuals move, heal, and thrive. Let's get moving. Across the province, Albertans can pick up the phone and connect with healthcare professionals who provide guidance, support, reassurance, and even rehabilitation advice, all at no cost. Joining us today to help explore these important resources are Kira Ellis and Andrea Jackson. Thank you so much for joining us today.
Yeah, thanks for having us.
Yeah, thanks for having us.
So, to start us off, could you maybe each share a little bit about your background and the journey to working in this specific area of healthcare?
Sure, I'll take it. First, Andrea. My name is Kira, and I'm a physiotherapist. And my background has been working in private practice and also in the public system for the last 28 years as a physio. And more recently, I've been part of the HealthLink family starting in 2020 when we set up the rehabilitation advice line.
And yeah, my name's Andrea Jackson, and I've worked in the addiction and mental health fields for, I think, probably 18, 19 years at this point. I am an addiction counselor by trade. I started in youth addiction and mental health for about 14 years of my career, and then I moved into the program manager at HealthLink in 2022. Where I support the Addiction and Mental Health Helpline, the Indigenous Support Line, as well as the Alberta Quits Helpline.
Great. Well, thank you both. I'm excited to dive in. I think this is an area that not a lot of people necessarily know. They maybe have heard, call 811 if you're looking for health advice, but they might not necessarily understand the depth of resources that are available. So, I thought maybe we could dive into one line at a time if that works for the two of you today. Maybe let's start with the rehab advice line. Kira, how does
Sounds
that
good.
work and who can call?
Yeah, great question. So the rehabilitation advice line is a line in HealthLink, and people can reach us with 811. So most people historically know 811 as a nursing service. So if they are acutely sick or have a sick child, they have used 811. So the rehabilitation advice line actually fits into that same 811 service. And when somebody calls that number, they get some options to choose a service and the option to speak to a physiotherapist or an occupational therapist or to learn more about AHS funded physiotherapy is part of that phone menu that they're presented with. And so when they choose that option, it comes through, and the next available clinician will take that phone call, and they can really call about any sort of rehabilitation concern that they might be facing.
Do you find that there's more common issues that come through than others, or is it a whole realm of possibility that comes through the line?
Yeah, that's a great question because we are the first of its kind in Canada that we know of. Other provinces are certainly looking to us and trying to learn about how we are doing this service, but we are the first of its kind, so we've really tracked that closely to know what kind of calls we're getting. In the early days, in 2020, when we started, we first partnered with the University of Alberta and used machine learning to pull out words out of our notes to find out why people were calling. So we weren't very savvy at that point in time, but we had savvy people at the university who helped us find out that a lot of people were calling about pain. I think it was over 90% of people were calling about pain. Then we got a little bit fancier over the years, and we've grown and started using more guideline driven triage, which means that we know how to ask and what questions to ask based on how the person is presenting over the phone. So, most of our calls are related to musculoskeletal problems. Uh, Very typical type physiotherapy type concerns, low back pain, shoulder pain, knee problems, long-standing chronic issues like osteoarthritis. And then we also get people calling before they go for surgery, sometimes after they've gone for surgery. We hear from people that have chronic neurological problems like Parkinson's disease, maybe have had a stroke a number of years ago and are facing some troubles. But we also speak to people that are supporting loved ones, like frail elderly parents or loved ones. So we see a wide range of calls. And most recently, we added some expertise in the pediatric area. So we have um, learned how to support parents and caregivers who are worried about their child's development. So it really is a wide range of reasons why people might call, from really birth until an older adult age group. So we've been really fortunate to have great data from our electronic medical records, so we can really see that it's primarily musculoskeletal, but all of those other things are reasons for calls too.
That's so fantastic. And you mentioned that you've gotten fancier as you have grown up as a line. Uh, How do you determine whether someone needs in-person care, you maybe need to
Mhm.
drive them towards an urgent care, or if a virtual follow-up might be appropriate?
Well, all of our clinicians at HealthLink, including nursing, Andrea's addictions and mental health team, and the rehabilitation advice line, we all use a licensed product called Schmidt Thompson. And these guidelines help us determine if somebody calls, they give a reason for their call. We work through questions to determine, is this an urgent issue, all the way down to is this something that you can manage on your own at home. So we really rely on those guidelines, and so we always start with the most urgent questions. It's almost a funny question to ask, but I'll give an example that we've had to become comfortable asking. Do you have a bone sticking through your skin right now? If somebody answers yes, we know that this is a more urgent call than staying on a phone and talking to a physiotherapist or an occupational therapist. So we work through all those questions, and as soon as somebody answers yes to one of our questions, we can see then, is this something that requires 911, urgent care, maybe their family doctor within a certain time period? Or is this something where we can actually give out rehabilitation advice and support them on their next steps to recovery?
And that might segue nicely into we have a virtual rehab team here in Alberta, and I think a lot of people aren't really aware about that. And so that's an additional line on top of the rehab advice line, correct?
That's right. Yeah. So our big line is the rehabilitation advice line, which is like a teletriage, very similar model to the nursing teletriage line. But the virtual rehab team came to be a little bit differently as we were well equipped with virtual technology. People came asking, "Do you guys think you could support patients in rural and remote communities using all of the technology that you have at hand?" So we dipped into that sort of world where we have physiotherapists and occupational therapists that are working in Calgary, but supporting patients in rural and remote areas. And this is really happening in a lot of different areas. It's happening in home care, ambulatory care, supported living, long term care, and even we occasionally dip into the acute care urgent need where maybe there isn't a physio or an OT to support the patient. So this is a different a line of work a little bit from the teletriage. These clinicians have a caseload. So a good example is right now we have clinicians here in Calgary that are supporting patients in Medicine Hat, in High Level, Fort McMurray, and a few new communities coming soon. So we've really been able to reach places that have had long-standing vacancies for physios and OTs. And yeah, so far it's been a very exciting service. Patients have received it incredibly well, very high satisfaction rate because they're getting care that they would have otherwise not received.
And is this a self-referral line, or does someone need to be referred to the virtual rehab team in order to access it?
Yeah, that's a good question. The referrals really come from the local physicians or other allied health clinicians. So the referrals go to, for example, the high level um, allied health department, and then our clinicians take those referrals and see those patients virtually. We've paired this in a different type of model where we have a therapy assistant usually on site with the patient or in their home to do the work so that we still have some in-person supports, especially for patients that require some in-person, physical supports when they're going through their assessment or treatment. Um, yeah, so it's been a very exciting, growing team. So it seems like we continue to find not great for these rural remote communities that they have these long-standing vacancies, but exciting for us that we're able to support them.
Do you find that there's certain conditions, or even populations who maybe benefit more from having the virtual rehab program in place?
I think we've found it to be really effective with our ambulatory and home care patients. And even some of our more complex patients, we've found we can treat them where you would, on paper, look at it and say it doesn't look like it's a very good fit for virtual care. But because we're tied into the local allied health department and we can pull in extra supports like a therapy assistant or potentially another nurse or a healthcare aide to support in the care, we've done as complex things as seating and wheelchair days for areas where people have been waiting for years for an assessment and just have not had those services. So it does take extra work in the coordination and sometimes in the planning before you see the patient compared to an in-person visit where the person just arrives into your clinic and away you go. You don't have to do that planning other than maybe book the appointment. So we've found so long as you take the time and have a bit of a process and plan in place for coordinating care, we've been able to do a lot of good work in home care, ambulatory care, long term care, and supported living.
Well, I think that one of the great things about this is meeting the patient where they're at. And so
Hmm.
your point, they're not having to even travel to a clinic sometimes, right? The care can come to them when it's being
Hmm.
virtually delivered and they can still have that high quality of care without maybe the restrictions that are sometimes there if they have to travel any amount to receive
Yeah.
that care normally.
Well, and when you look at our north zone in Alberta, so many people are just accustomed to having to drive to Edmonton for services. When we did the work around the wheelchair and seating, and it was in the Beaver Lodge and Hythe area that we did the work, they were just so pleased that we could do it, even though it was complicated and took a little bit of work and phone calls back and forth with a lot of different people. Patients were very satisfied, and so I think one of the big uh, myths that this team is busting every day is that older people are not going to receive virtual care well. Um, we predominantly work with older adults in home care and supported living, and they will always tell you it's different than receiving in-person care, which it is. It is different, but they almost, I think we're at like a 98% satisfaction rate that we've met their rehabilitation need. And so that is really encouraging.
Mhm.
And some people will even say, like, why aren't we doing this all the time? Like, we love this. So, I don't think we're here to replace in-person care. And I think that's also something that people will sometimes say, ooh, this is a bit scary that we can take away in-person care. That is not the plan. But when there is no care, this is a really good option.
Well, and I think in our current healthcare climate, we're seeing vacancies all over. And so I think
Mhm.
making sure that access to care piece and making sure Albertans are being looked after is so important. And if that has to be virtual, that's
Mhm.
better than not receiving care. And to your point, people
Yeah.
waiting for years to be properly assessed.
Yeah. Yeah, absolutely. And so we've been really excited to try it. We do something called a telehealth usability questionnaire at the end of their care episode of care with our clinicians. And I love the comments that come from patients and caregivers who said, they'll say things like, I was really, leery of taking this approach or nervous about using Zoom. And, the care they receive sort of shifts the way of their thinking a little. And they'll say, it turned out to be great. And I would recommend it again. And we're starting to see people recommending it to their friends. So, that's a great sign that uh, the work is being received well by patients.
And I imagine the survey also helps you to inform changes or additional services that maybe could be offered through the virtual rehab team and can continue to evolve the program as well.
Yeah, exactly. And the more kind of we get a little bit more sophisticated in how we do the work. We keep developing our processes, and we keep learning. What are the kind of the key factors for success in a new community. We really feel we could almost like lift a clinician from one community and shift them over to another if the needs should change. One of the things we know is that they're always looking for more clinicians to move to these smaller communities or more remote communities. But until they do, we're a good option. And if they do find somebody, there always seems to be another community kind of in the wings saying, well, we'll take that clinician. And so we call that the lift and shift. If we have to move somebody, clinicians know that they're almost working like a casual pool of or a locum pool. And we have that in other professions. We have it in nursing. And so this is just an example of how we can do it in allied health like physio and OT.
That's so amazing. It'll be really neat to see kind of how this continues to evolve and support
Mm,
Albertans, especially those in rural and remote communities.
mhm.
So, Andrea, one of the lines that you oversee is the Addictions and Mental Health Helpline,
Yeah.
which crucial role, and when especially if people don't know where to turn. Can you tell us a little bit more about what supports this line provides?
Definitely. So the Addiction and Mental Health Helpline is actually one of the few lines with the only other one we have at HealthLink is nursing that's 24 hours a day, 7 days a week. And so people can call from around Alberta if they are in crisis, if they have suicide ideation, if they have questions around their own mental health or a family member's mental health or friends, as well as substance use or addiction. We provide support based on what they need in that moment. And then we can also support them in providing resources that are available in their area, depending on where they are and what they need in that moment. Um, we work with them to give them strategies to help support them at home so that they can manage their substance use or their mental health concerns if that's what they need in the moment. Um, we sort of take it by each caller and what they're presenting with and what they need.
Do you find with most calls that come in, the team is able to uh, support those individuals fully, or do you sometimes have instances where they need to refer them on to other members of the community?
Yeah, I think it's a little bit of everything. Sometimes they're just suffering from some anxiety or they have some questions and they need some support. So sometimes it's just having those conversations and giving them some tools to sort of that they can take away and decide what they need to do next. Um, and sometimes it is more intensive support depending on what they need. So maybe they are struggling with some substance use or addiction and it's been going on for a long time and they're finally in that stage where they're ready to receive some services or access care in a different sort of way, we can get them connected. We've created over the last few years a lot of different pathways with a lot of services throughout the addiction and mental health realm so that we can either do direct referrals through our team to Access Mental Health or Access 24/7 up in Edmonton or the rural access teams so that they can access community supports. But we also can provide direction on what's closest in their area based on what they're struggling with. Um, yeah, a whole suite of different things that we can kind of provide depending on what they need in that moment.
I'm assuming maybe like Kira, there's quite a bit of data that has been collected around the line and helping to inform the program as it moves forward?
Yeah, definitely. I unfortunately didn't pull any of that data in this moment to kind of present here today, but we're really data rich here at HealthInc. I think it's one of the unique things with our line that we can pull from. And so we can look to see what types of referrals we're getting, where we maybe need to strengthen because we strengthen the team's education, depending on the types of calls that we're seeing. We do have a team of health professionals. They're all mental health therapists, and they have varying backgrounds in social work, psychologists, we have psych nurses. We don't have any currently, but we have had some OTs in the past with mental health specialties. And so everybody comes with a really unique background and is able to sort of support our callers in many different ways. And we can kind of work together as a team to kind of figure out what it is that we need to strengthen on, or where we need to go if we don't know the answer for particular questions. Like Kira, I think in the rehab advice line, we've really developed our resources over the years based on what callers are calling in for. Um, we also have a really unique pathway with EMS. And we call it the EMS shared response line. And so if individuals are calling 911 and it's not necessarily a 911 emergency, and it falls into a certain disposition for the EMS dispatch, they can transfer over to our line. And that's been a really great partnership because we can, on our line, have a mental health therapist, have that conversation and see what it is sometimes those people need. Um, and sometimes, like Kira said, they'll land in a disposition and we go through the same guidelines. Well, or we do the mental health guidelines, but same type of service where we can sort of determine from there what services are needed and when, and maybe it's not immediate. And so we're, their EMS isn't sending out an ambulance when it's not necessarily needed. And we're keeping those people out of the ER if they're not needing to be there, right? So
Yeah, absolutely. And you said you've curated a lot of different resources over time. If if someone is hesitant to call, are there still resources available online that are maybe connected to HealthLink that they can go to as a first step?
I think what's great about our line is that even if somebody's hesitant to call and they're not sure, they can just call us and ask those questions. They don't, while we encourage people to identify and let us know who they are, we don't need them to. We can still provide supports to them even if they can't. If they can tell us at least where they're from, we can help tailor those resources and direct them to some of those things. We like to call them gold star resources because the nice thing about our team is that we've vetted them. We've made sure that they're good resources and the information there is true and accurate.
Which is why I think that's so important, like that idea of being able to access trusted resources. I feel like Google can be a really slippery slope sometimes, and if you don't maybe know how to vet the different resources that are available, sometimes you may access something that's not going to help you, but could actually hinder you in the long run.
Definitely.
When it comes to the addictions and mental health helpline, are there any specific demographic trends that you've seen, or has that shifted and changed at all over time?
The interesting thing I find about our line is that
Mhm.
it's pretty steady. It's pretty normal to see calls from numerous demographics. I think we do see a number of people calling between that 25 and 40-year-old range. Um, but then there can be times too, like we have everyone calling from youth, like teenagers to adults to seniors. And it can ebb and flow over a year,
Mhm.
but we kind of see everything and anything.
And you mentioned earlier it's a 24/7 line that people are able to call. Do you find there are times of day where the volume may be higher than others?
Yes and no. Mondays are typically our busiest day for calls. Not sure why that is. I always find it fascinating, but it's been like
Mhm.
that since I joined the team in 2022. So we know we see that. Um, Usually peaks up in the evening as well, and we see higher call volume then, as well as sort of midday. always lower in the evening. Most people are sleeping then, but then there are some days when we see higher call volume then. Um, we know sometimes in January too, it can peak after Christmas time, but we also know Christmas time and the holidays can also be a really tough time for people.
Right. Yeah. I was just curious. Mondays, that's an interesting thing though.
Hmm. Hmm.
Um, Shinora, so another line that you oversee. I love that there is so much access for Albertans.
Hmm.
The Indigenous Support Line,
Yeah.
again, a very important service. Can you explain maybe a little bit about um, its purpose and how it came to be one of the lines in the 811 suite?
Yeah, so the Indigenous Support Line came to us from an idea from the Wisdom Council, um, formerly with AHS, where there was the elders wanted a line to support Indigenous people across the province navigate the healthcare system. Unfortunately, there's still a lot of racism and discrimination against Indigenous people within the healthcare system. And so this line came as an idea to help support that and help to support Indigenous people in accessing care because it is seen that they're not accessing care in the way that we would hope that they could. And so that basically created the Indigenous support line. The Indigenous Wellness Corps at the time came to HealthLink to partner on the line. And so we started with just two Indigenous mental health therapists, and we refer to them as listeners. For the line, and we've now grown, and we're growing even more, hopefully, here in the new year. So we'll have about, I think there'll be 8 of them um, answering calls to this line. And we support all Indigenous people, Métis and Inuit across the province that have any sort of questions about the healthcare system or navigating it, or if they've experienced racism or discrimination in the healthcare system. Our listeners will, we try, so the line is also only staffed by Indigenous individuals. Um, we want to make sure that when Indigenous people are calling, that they are speaking to somebody who understands what they're going through and that will take the time to listen to their story and help them move forward with kind of whatever their ask is. Sometimes it is just listening, and sometimes it's supporting them and following up with a formal complaint. Sometimes it's helping them access resources. Sometimes it's accessing cultural supports, or they need access to smudging. Um, and so, yeah, we are just there like with open arms to listen and understand what it is that they need and see if there's something that we can do to support it.
And have you been finding with the line it's really helping to bridge that gap when it comes to Indigenous patients looking to navigate the healthcare system?
I think we're trying to. I think unfortunately, what it's highlighted is a lot of that systemic racism that is occurring. I think we're aware of it, but now we're hearing real stories in real time from people on what their experience is. And so we're really trying to bridge a gap between um, units and areas in the healthcare system in real time to sort of address those needs. And so I think we're trying to, and I
Yeah.
think we're highlighting some of the pieces that we need to work on. Um, and I think, and just support to try to create a better experience for people. And then we also try to work as a team to provide education and support to professionals as well, because we're also open to professionals in the healthcare system. If they had a question and they have an Indigenous patient and they want to help advocate for them as well, we encourage them to call the line so that we can help them advocate and get the supports or resources that that person needs.
And do you find that hearing the stories and hearing what's happening in the system that it can feed back and help healthcare practitioners to support better like culturally safe care for the Indigenous population?
100%. Part of some of the work that we do as a team is when we hear stories and we hear what's happened for individuals, we try to to find themes that are going on in certain areas. And we try to feed that back to the organizations and to the centers, because we also do hear from centers saying we want to do better, we want things to look different. So how can you help us with that? And I think working with the Indigenous Wellness Corps, working with different sites, um, we're trying to feed that information back so that they have areas that they know that individuals would like information on. But I think we all just have a role to play to seek to understand that, and we're trying to support them in finding that knowledge and understanding what that is and what and how it could look different.
That's so wonderful, like, to be able to have that and to be able to learn from what's, being
Mhm.
shared through that line. In terms of demographics, do you know if it's a lot of, individuals who are living more urbanly, or is it really a bit about that access to care? Again, just thinking about how widespread our province is and the population being very,
Mhm.
um, like, in some areas, like, quite remote and removed from urban centers or, like, major access
Yeah.
to care.
Well, and it's interesting. So we've had a stage approach to how we open the line. So we opened in the North Zone, and then we gradually moved into the South and then Central, and then just more recently this year opened to Calgary and Edmonton. Um, and so the reason being that we did that staged approach was we knew there was less access to care up in the North. And so how can we bridge that gap? What is it that we can offer? How can we be of support? Um, and so we still do get calls from the North Zone, and it is, a part of the province. Obviously, we support rurally different areas. We do see a lot of call volume coming from Calgary and Edmonton. Um, but I think if you look at it, it could be just based on population. We're going to see more people in the urban areas anyways. So um, I just think we see a little bit, like we do see it in coming from rural, but we also see quite a large number coming from urban areas as well.
Well, I think just so wonderful that you've been able to expand the program and be able to
Mhm.
capture the entire province.
Definitely. It was always a hope of ours, but of course, money's always a factor, right?
Yeah.
So it's proving our concept that you know, we're useful in a sense, or the work that we're doing will benefit people, right?
Well, and it's so meaningful, I think, too, to be able to help support anyone to access the healthcare system.
100%.
Okay, so we have one more line that's part of this family of lines at the virtual pain program. Chronic pain affects a huge number of Albertans. Hero, could we dive into what does the virtual pain program offer and what makes it so different
Mhm.
from traditional pain management?
Yeah, great. So I'll tell you a little bit about this team. This is a multidisciplinary, interdisciplinary team of allied health professionals. Um, and really, where what was noticed was there was a gap in care or an inequity in access to care for people who are living with chronic pain. So, in the same way, like Andrea highlighted, uh, they're talking a lot to people in rural remote areas, but we're also talking to people in urban centers because access to chronic pain services is difficult. And so what was happening is there was a real demand for tertiary multidisciplinary pain services, and really long waits to get into those programs, and they typically were only in urban centers. So the former Alberta Pain strategy, which was part of AHS, that pain strategy came up with a plan to have a virtual pain program. And the virtual pain program developed over time and just actually recently won an award from Health Quality Alberta because they integrated patient feedback into the development of the program. And what they landed on was offering a 6-week group virtual program for people living with any sort of pain condition that they've lived with for more than 3 months. They really wanted it to be easy for people to access, so they wanted to knock down barriers for the referral. Um, and really wanted people to not even need a diagnosis. So you could be living with pain, maybe undiagnosed at this time, but what can we help you with while you are potentially waiting for more specialized services or one of these tertiary interdisciplinary pain programs? So the 6 week program runs twice a week. So it's 12 sessions total with a maximum. We try to keep the groups between 10 and 15 people. Sometimes they're a little bigger than that, sometimes they're a little smaller. And they're facilitated by licensed professionals. So the first session of the week has two clinicians. We have mental health therapists, we have physios, occupational therapists, social work, um, and I'm missing somebody. Let me come back to that one. So these licensed clinicians, they run the first group of the week, and then the second group is facilitated by peer support workers. This is something new to me and new to HealthLink to have peer support workers. They are people who have done some training in how to be a peer support worker, and they also are a person with a lived experience. So the peer support worker is somebody who themselves live with chronic pain, and they're bringing this group of people together, to share their experience and to encourage connection and support through having a not necessarily the same problem, but similar lived experience. And so that 6 week program has been really well received. We continue to fill those up with either referrals from healthcare providers or the patient calling in to self refer. So there's both of those ways to access the program. And we also have a second option for people if they aren't able to attend these groups. There's a real evidence that people living with pain do better managing their pain when they have learned about sort of these more conservative strategies on how can I improve my quality of life while living with pain. And so there's an online portal through the Power Over Pain portal that's attached to the University of Ottawa. They've partnered with this group and have allowed a more tailored Alberta version of the online learning, and people could choose that option too. So there's not only the group. Some people don't like groups. Some people, feel that that's not for them for whatever reason, and that is totally fine. There is other options. So this online learning is more self-directed, self-paced, and that can be a good option for people that just can't make it into these scheduled groups.
That's great. And I think just so important to be able to access resources if you want to do it solo to maybe understand a little bit more around what you can do. But gosh, the power in the group. I love that idea of having the peer led. And what better way to I think understand that you're not alone in this journey. Like it always surprises me.
I think the storytelling is so therapeutic. And I know there's research behind that, but when people can share their story and be heard, that can really help them, make the next step towards how can I manage this better. It can be very overwhelming for people living with pain.
Yeah, absolutely.
Yeah.
So these between all five of the lines, like the programs collectively support thousands of Albertans each year. Do you have any like stories or anecdotes around the impact that you're seeing across the province from any of the individual lines or as a whole?
Oh, I think there's too many to count, really, for stories. Um, oh, we have just like some that are fun, some that are sad, and some that are just so reassuring that there's a good reason we're doing all this work. And I think the stories that we hear are the things that keep us going because it is hard working in a large healthcare system that, as everybody is aware, is consistently changing. I mean, Andrea and I have both been working here through the pandemic. HealthLink was a very busy and continues to be a very busy place when it comes to public health. And so I think when we hear the patient stories, I know I can share one from my virtual rehab team that is very recent, where we actually had an Indigenous elder um, recommend our therapist, who has been working in high level for quite some time, and recommended that her friend, another Indigenous woman, attend physio because the physio that was working from Calgary had helped her so much. And so when we see that, I think because I know Andrea's stories as well, to me that is just where it all comes together, and we're seeing some successes. So it is all of the smaller successes that I think has built both of, not both, but all of these programs into being, very well received by the communities.
I also think like what comes to mind is when we hear from our team when we've had a call and somebody's suicidal or somebody's not doing well and they're having thoughts, when we can get them to a place where they're accessing care or they've agreed, they're in a better place when we've ended the call with them and they're able to connect with their healthcare provider or their counselor, somebody they're connected with, or we're able to connect them with that resource when they otherwise wouldn't be. Those are always moments that I know the team celebrates as well. I think too with the Indigenous support line, we hear from many people that it's the first time that they felt listened to, that they felt heard, and that we've walked through their journey with them. That's something I like to highlight with the line is we do something called warm walk-alongs, and we work with Kira's team if they need rehab support, or we'll work with other teams like triage nursing. But we stay with them when we take those calls over, like transfer those calls over, and then we bring it back to the line and we continue to support them because maybe transportation's an issue. So they need to go into hospital, they've been assessed by a nurse, and our team supports them in getting that transportation. And I think that's the biggest thing is when you hear those positive stories that we're able to help people get help and that they feel like that they've been heard. I think it
Mhm.
can just change the narrative and change the direction of how people see, you know, their journey.
Mhm.
Yeah.
That was actually a question that I had was how often do people, how often are people referred back and forth through the lines, depending on what you uncover while you're triaging?
I don't know that we transfer too much because we don't want people to feel as though they have to jump from one service provider to the next service provider to the next. But I think we do a really good job at HealthLink if somebody identifies a different need outside of the line that they've called. We see it a lot with the dementia advice line that's through HealthLink. If somebody is struggling with some mental health or substance use, and then they also have some questions around dementia, we can put that referral through and have somebody call them back. And the same with Kira's line. If they have somebody that is struggling as well with their mental health, they can put that referral to us and we'll call them back. So we've created these pathways so people don't feel as though they're being bumped around our lines, but they also don't feel like they're left without the support to those questions that they might have.
Yeah, I'll just add to that. Like, we really don't want to have that whole ping pong effect, which is very common in the healthcare system. People will walk through one door and be told this is not the right door. We really look at any door is the right door when you're looking for support. So I think Andrea and I were talking like what would be one key thing we would want people to know about HealthLink, and there's no wrong reason to call HealthLink. You might talk to a person that says, "Oh, I think you'd actually do better speaking to a mental health therapist right now," or are you open to that idea? But we really strongly encourage people to call if they're looking for any kinds of supports. And in addition, um, we're happy to talk to healthcare providers too that might be struggling navigating the system. So we feel, and we, sometimes forget how well versed we are now. If a healthcare provider, we've had pediatricians call us, we've had orthopedic surgeons, neurologists, physios, OT, social work commonly calls, the rehab advice line, because we do speak to so many people who have live with a disability. So um, just encouraging people to look at HealthLink as a good option if you're not sure where you should go or where potentially some of your own patients or clients should go. So um, just wanted to highlight that piece around HealthLink.
How do individuals find out, like, in terms of the awareness of health? Like, I feel like this is one of the best kept secrets in our province. Um, what do you currently do to promote it across the province, and especially in those rural and remote areas where they may not have that same access to care?
I mean, we really try to use our social media platforms. We have recently moved into Primary Care Alberta. So we were formerly part of the Alberta Health Services group, but now we are separate into the Primary Care Alberta group, who's just sort of getting a hold on the social media side of things. But we have a communications team that really is supportive wherever we can speak to a group. Recently, was I was invited to speak about the Alberta Virtual Pain Program at an Indigenous home care nursing conference in Edmonton and Calgary, and so we take those individual opportunities to connect with people more directly and see how we can support um, their patients or their community, depending on who we're speaking to. And so there's ongoing community engagement that sort of never ends. And I think what we've learned from triage nursing, they've been active for 25 years, and it probably took 5 to 10 years for them to be as well known. So if I say I work at HealthLink, sometimes people don't really know what that is. But if I say I work where you call 811, people are like, "Oh yeah, I've called there before." So we continue to do that community outreach for all of our different services. And whenever we can, we do things like this. So we hope we reach a larger audience, and we encourage people to connect with us if they're watching or listening to this, if they have questions, because the more we can speak about it and raise awareness outside of our close circles that really do know a lot about us, it just gets the word out more widely.
Andrew, anything you'd like to add about that?
Um, I think Kira sort of covered it. I think the neat thing with the addiction and mental health helpline is those lines have exist beyond when they came under HealthLink, and so they're two toll-free numbers that do feed into our line. So there's a mental health helpline, and there's the addiction and mental health, or the addiction helpline. Sorry. Um, but they all come into our line. So I think it's through social media, it's through our community partners. Um, it's building those connections, I feel like, with other professionals, so that they can provide our number as a number for people to call, especially in those after hours when they maybe can't reach their other supports that they might have. Um, so yeah, and then I think it's just continuing to promote it, and promote the work that 811 is doing.
Yeah, and such valuable work too. So I think for anyone listening, make sure you tell a friend about it if they don't already know. I know we, as an association, we refer people to 811 all the time. We constantly get calls, and we always say, this is the best area, like the best line to call to help direct you to the healthcare that you need or you may be looking for. So I think word of mouth can be pretty powerful as well.
100%.
Yes. Thank you so much for doing that.
Our pleasure. Uh, Kira, in addition to the 6-week program and the self directed learning online, are there any other programs that the Alberta Virtual Pain Program offers?
Yeah, there are. They've been working really hard at developing some online virtual workshops. So they're interactive workshops with our licensed professionals. And they're on topics that patients with living with chronic pain have identified as sort of key topics of interest for them. So, topics such as fatigue, concerns with intimacy, learning more like what is chronic pain, They are working constantly on developing that material, and we have a large number, I think we're up to 11 workshops that are available online at no cost to patients. Those can be found at our new Primary Care Alberta website. And so I really encourage people to take a look at those options as well. Sometimes a 6-week group can be a bit overwhelming in the amount of time that people need to dedicate. It can be a nice way to try it out and see if they like that format and to see if the topics are of interest to them. So I really encourage people to take a look at those workshops.
Great. And we'll include that link as well for those that are looking to access it. So thank you.
Yeah, thank you.
So just as we wrap up, would love to know, I mean, you're both working in a constantly evolving space, and really these lines offer exceptional access to care in this province. And as you said earlier, Kira, we're kind of setting the trend in Alberta by doing something that no one else is. What excites you most about the future of virtual and telephone based care in Alberta?
I think it's a solution to some problems, not all, but I think it can really bring care to people that would have received nothing. And, I think it keeps patients at the center. There's no way to um, not have patient centered care when you do it over the telephone or virtually. They really drive what you do in those sessions, and you can have very rich rehabilitation assessment and therapy and great outcomes. And we're seeing it and we're measuring it, which is also very exciting.
I can add to that a bit. I think it's really interesting because I think what Kira said earlier around just we're not here to replace that in-person component to care. I think having connection with people is so important when it comes to healthcare, when it comes to our mental health, when it comes to making change. But I think it's so exciting to know that there is a platform that we have for people that don't have access to care or that just might need one episode of care to sort of get them to the next step. And I think that's where um, virtual care and telephone-based care fits into the mix. I think that we're really trying to pave the way that to see that there's lots of opportunity for it, but it's about how we build it and how we work together with the system at large to have it work and work together. So um, I think it's exciting to see.
Very exciting. And I'm so grateful to have had both of you come on today and share a little bit more about both the lines. I hope for anyone who's tuned in, if they are uncertain about where to go for healthcare, or if they know someone who maybe is trying to figure out that path forward, they pick up the phone and they call 811, because I think from hearing today, we know they're going to have a fantastic experience, and we know they're going to get either the care that they need or pointed in that right direction. So really thank you to both of you.
Thanks, Jen.
Yeah, thanks, Jen.
So wonderful to learn about the breadth of HealthLink here in the province. If you're interested in learning more about physiotherapy or to find a physiotherapist near you, visit albertaphysio.com. See you next time.